Hello everyone, I'm Christopher Kent. Your September 2013 issue of On Purpose is on the way. In science, we lead with some excellent papers addressing the benefits of chiropractic care with a focus on pediatrics. In the Journal of Clinical Chiropractic Pediatrics, the first article discusses costs of routine care for infantile colic in the UK and the costs of chiropractic care as a management strategy, and it includes an RCT for this condition. Significant cost savings are realized when chiropractic care is used instead of conventional medicine alone. A Chiropractor's Guide to the Epidemiology, Clinical Diagnosis, and Treatment of Pediatric Cough is presented and includes a description of the possible neurobiological mechanisms that can create favorable changes in such patients when their vertebral subluxations are adjusted. We have a paper on Down syndrome and chronic ear, nose, and throat infections, a case report, resolution of birth-related cranial asymmetry following chiropractic care, another case report, and a discussion of the benefits of chiropractic care for the infant with idiopathic central sleep apnea, another case report. From the Journal of Upper Cervical Chiropractic Research, we review the use of cone beam CT to evaluate the occipito-atlantoaxial articulation in a 75-year-old woman with migraines who is undergoing Blair technique. Blair technique, of course, focuses on the relationship between the occipital condyle and the lateral mass, and this technology provides some truly spectacular images. We also discuss biological oscillators and entrainment, hot flashes in the autonomic control and heart rate variability changes associated therewith. We report on telomeres and longevity and discuss a paper about prostate cancer and autonomic nerve development. Finally, we review the holographic theory of brain function, recalling a meeting which we had with Karl Pribram, as well as the latest research that challenges the Brodmann-style compartmentalization of brain function. In politics, we discuss the recent attack on pediatric chiropractic in Australia and the investigative report on the TV program Catalyst. We tell you about the latest Court of Appeals ruling on the New Mexico drug issue. We review a bizarre article by a California physical therapist group suggesting that PTs are safer than DCs and that DCs should actually be forbidden to adjust. We discuss the case of a courageous Oregon chiropractor fighting the board to clear her name after being exonerated in a court proceeding. Accusations are still listed on the website, or were, and she challenged that, saying that they were damaging to her reputation and her business. Finally, we have a section reviewing the latest on vaccinations, another interesting topic, and for our philosophy interview, we have a real treat for you with Dr. Jeannie Ohm of the ICPA, the International Chiropractic Pediatric Association. So stay focused, share this information with your patients and community, use the news releases, and remember, when you're on purpose, you are not alone.